Are Medicare Advantage plans good or bad? You worked hard your entire life to retire, and Original Medicare exposes you to unlimited loss. And medical debt is the leading cause of bankruptcy in the US. So, at face value, Medicare Advantage plans can potentially save you thousands of dollars. But there's a lot of talk in the news about companies dropping Medicare Advantage plans. But why is this happening? What happens if they drop your plan, and can they deny you coverage? With nearly 2 million people facing higher out of pocket costs in 2025, it's essential to know what options are still available to you. Do these plans actually save you money? Is it safe for you to switch to an Advantage plan, and what's the risk? Why do some people say Medicare Advantage plans are bad, and do they provide you more coverage? And most importantly, do you qualify? I'll address all of these questions and more in today's video. I'm Callie, and I'm a licensed insurance broker and certified Medicare expert. I help people across the country find the right Medicare plan for them, and I want to do exactly the same for you. Medicare Advantage plans are an alternative to Original Medicare, and it's also known as Part C. If you decide to enroll in a Medicare Advantage plan, then you're choosing to receive your Medicare benefits from a private insurance company that's approved by Medicare. And these plans work very much like how your marketplace or employer health plan worked before. You basically have two options when you enroll into Medicare. The first is Original Medicare, which is Parts A and B. Part A is your hospital insurance, and Part B is your medical. And you receive these benefits through the federal government. Under Original Medicare, you have deductibles, copays, and coinsurance. And after you meet your deductibles, Medicare pays 80% on your medical bills, and you're responsible for the remaining 20%. And that might not sound like a lot, but under Original Medicare, there is no max out of pocket. So essentially, there's no cap on how much you could spend on medical bills. Original Medicare also doesn't cover prescriptions, so you have to add on a Part D prescription drug plan to cover any prescribed medications that you pick up at the pharmacy. And technically, Part D is optional, but if you don't get Part D when you're first eligible and you don't have credible drug coverage through an employer or your spouse's employer, then you'll be hit with a Part D late enrollment penalty, and that's currently 1% for every month that you don't enroll. Many people that go with Original Medicare choose to add on a Medicare supplement plan, which is also called a Medigap plan. These plans pay your portion of copays, coinsurance, and deductibles after Medicare pays their 80%. But not everybody can afford to pay a Part B, Part D, and Medigap premium, or maybe you didn't know to enroll in a Medigap plan when you first turned 65, and now you can't get approved for that Medicare supplement plan because of health issues, and that's where your second option comes in. Your other option is to go with Part C, which is a Medicare Advantage plan. Medicare Advantage is not Original Medicare, and it's not a Medicare supplement plan. It's very important to differentiate the three, but you must already be enrolled and stay enrolled in Medicare Parts A and B to get a Medicare Advantage plan. And you also have to live within the Medicare Advantage plan service area. Once you enroll into a Medicare Advantage Part C plan, you're basically replacing your original Medicare benefits with this Medicare plan from a private insurance company. So if you go to the doctor or hospital, they'll bill your insurance company, like United Healthcare or Aetna, or whoever your Medicare Advantage plan is through, instead of Medicare. The insurance company will be the one paying on your medical claims, not Medicare. In most parts of the country, Medicare Advantage plans cost you $0 a month. You'll still have to pay your Part B premium to have a Medicare Advantage plan, so they aren't exactly free, but you usually don't pay an additional amount on top of your Part B. Medicare Advantage plans also usually include extra benefits that Original Medicare doesn't cover, like dental, vision, hearing, and prescription drug coverage, or your Part D benefits. And out-of-pocket costs really depend on your specific plan choice and where you live. Some have deductibles that you'll need to meet before your certain benefits kick in, and copays or co-insurance whenever you see a doctor or specialist. But the good news is they also have a max out of pocket, so you know exactly how much you might end up paying in a worst case scenario. A lot of these plans also have things like an over-the-counter benefit that you can use every month or every quarter to pay for over-the-counter items like ibuprofen or cold and flu medicine. If you're finding this video helpful so far, go ahead and give this video a thumbs up and hit that subscribe button to stay up to date on more Medicare tips just like this. And most people in Medicare live on a fixed income, so the benefits of Medicare Advantage plans like free dental are really appealing because, hey, I've had a tooth extraction and that alone can cost over $600. With all these added benefits, it's important to know the type of Medicare Advantage plans out there and how they work. First, you've got HMO, PPO, PFFS, which is private fee for service, and S&P plans. Each of these have their own setup and network flexibility. Most people choose between an HMO or PPO, and most of my clients choose to go with a PPO because they want the freedom to go to doctors out of network. With an HMO, you're required to stick within a network of providers, and you'll also usually need referrals to see specialists like a cardiologist or a podiatrist. On the other hand, a PPO gives you more flexibility and freedom to get out of network care, but that usually comes at a bit higher cost. Now, all of this isn't to say Medicare Advantage is perfect. I mean, we've also seen a lot of this in the news.
Texas and National Hospital Advocates say privatized Medicare plans threaten both patient care.
Hospitals in Bismarck are ending their contracts with Humana Medicare Advantage.
Thousands of Minnesota seniors are trying to figure out what to do with word today that Essentia Health is dropping some Medicare Advantage insurance plans.
That's a bummer, I know. I'm sure y'all have all heard or seen that insurance companies are dropping Medicare Advantage plans. What do you think is behind it? Let me know in the comments. I'd love to hear what y'all think. Basically, a lot of these companies just flat out struggle to make a profit on these plans. It's mainly because healthcare and prescription drug costs keep going up. Another reason is that some doctors and hospitals are dropping out of these plans or don't accept Medicare at all. And this is due to a lot of reasons, but just a few that come to mind are insurance companies or Medicare don't pay them enough. Or insurance companies put too much restrictions in place, like the need for prior authorizations, and doctors and hospitals decide they don't want to accept those plans anymore. So essentially, that makes it harder for insurers to make a profit off of Medicare Advantage plans. I go into this a bit more in my other video about changes to Medicare in 2025, so be sure to check that out. But what happens if your Medicare Advantage plan is canceled or dropped? If you're one of the 1.5 million people getting their Medicare Advantage plan canceled, you actually have a unique chance that most Medicare Advantage members don't get. And that's that you can go back to original Medicare and pick up a Medigap policy, and you don't have to worry about medical underwriting. That means you won't have to answer any health questions or risk being denied coverage, even if you just recently had a cancer diagnosis. So is it safe to switch to a Medicare Advantage plan? It really depends on your situation. While you do get extra benefits that original Medicare doesn't give you, and usually at no extra cost because the only premium most people pay is their Part B premium. Personally, I know that a lot of my clients live on a fixed income, as do many people retired and on Medicare. So for them, a Medicare Advantage plan just makes the most sense. They're great if you're comfortable with the plan's network and network limits and understand the potential out-of-pocket costs. Medicare Advantage plans do have things like deductibles and copays, and some even have low premiums, but I found that almost every insurance company has a $0 premium Medicare Advantage plan. Something I do want to address though is network restrictions. Medicare Advantage plans can't deny you coverage for basic Medicare covered services, but they can have restrictions for some treatments. Some services may need pre-approval or prior authorization, and there could be limits on how often you get access to specific treatments. So you might not like being told where you can go and where you can see. And I get that. But since Medicare Advantage plans are provided by private insurance companies and you're no longer receiving your benefits from Medicare, you will be restricted to the doctors and hospitals within the insurance company's network. And some doctors, mental health professionals, and hospitals may not accept Medicare Advantage plans at all. So it's very important you do your research to make sure that your current doctors are within network before you make the switch to Medicare Advantage. So are Medicare Advantage plans are good or bad? Let's look at both sides. I'd say that Medicare Advantage is a great choice for a lot of people. These plans have extra benefits like dental, vision, and over-the-counter stipends, which original Medicare just doesn't cover. And since most plans have a low or $0 premium, they're a really affordable option, especially if you're living on a fixed income. But there are downsides that we talked about, like those network restrictions, and some treatments or specialists might need prior authorization. And remember, once you're on a Medicare Advantage plan, and unless it's canceled, switching back to original Medicare with a Medigap policy can be hard if you have health issues, since Medigap companies can deny you coverage based on health. So if you're turning 65 and new to Medicare, I would strongly recommend you look into a Medigap plan first, because this is your Medigap open enrollment period. Shop around and see if you can afford them, not just right now, but in the future, because premiums in Medicare supplement plans can vary a lot and they do have rate increases. To give you an idea, in this area of Georgia, Medigap plans can range from anywhere from $42 per month to $397 per month. That's a big gap. Medicare Advantage has its ups and downs, but it's a great choice for a lot of people. If you're looking for extra benefits and don't mind sticking within the plan's network, these plans could save you a lot of money and cover things that original Medicare doesn't. At the end of the day, I think it really comes down to finding the right fit for your needs and budget. If you found this video helpful, please like this video and subscribe to the channel for more expert insurance tips. And hey, if you're still unsure, That's what I'm here for, to help you make sense of all your Medicare options and find the best plan for you. So click the link in the description below to schedule a completely free consultation. And after that, check out this video right over here if you want a full picture of Medicare and how to get the coverage that truly fits your needs and budget. I dive into Medicare Part D, and it's packed with info on prescription coverage and tips on avoiding penalties. Thanks so much for watching, and I'll see y'all next time.